Let me begin with a question that many men over 50 quietly carry in their minds, but rarely feel comfortable saying out loud. What does it mean if you reach climax, but nothing comes out? Perhaps it happened once, unexpectedly. In that moment, you felt the familiar wave of pleasure, the same neurological sensation you've known your entire adult life. But afterward, something felt different. There was little fluid, or none at all. And almost instantly, a quiet worry appeared. Is something wrong with me? Maybe you dismissed it at first, but if it happened again, the question likely became harder to ignore. Some men feel confused, others feel embarrassed, and many simply stay silent, hoping the situation will somehow correct itself. If this has happened to you, whether once or repeatedly, this conversation is important. Not because something terrible has occurred, but because your body may be sending a message that deserves understanding. A urologist who has spent more than a decade helping men navigate the changes that occur throughout different stages of life. And today I want to talk with you about a topic that is rarely discussed openly, yet surprisingly common: experiencing climax without the expected release of seminal fluid. First, I want to reassure you of something very important. This change does not mean your masculinity has disappeared. It does not mean your intimate life is over. And it certainly does not mean your body is failing. Think of it differently. Your body is communicating, and like any message, it simply needs to be interpreted correctly. Over the next few minutes, we'll explore what might be happening inside your body. We'll talk about the most common causes. We'll discuss the warning signs that should prompt medical attention. And we'll look at practical solutions modern medicine offers to restore confidence and peace of mind. But before we talk about what changes, we need to briefly understand how this system normally works. The male reproductive system operates like a carefully synchronized orchestra. Several organs play different roles, yet all must work together with precise timing. The testicles produce sperm. The seminal vesicles generate a nutrient-rich fluid that nourishes those sperm cells. The prostate contributes additional protective fluid. These components combine into what we commonly call semen. When sexual stimulation builds toward climax, this mixture collects within the urethra. At the moment of ejaculation, specific muscles contract rhythmically, pushing the fluid outward through the penis. It happens quickly, often within seconds. But behind that moment lies a remarkably coordinated interaction between nerves, glands, muscles, and hormones. Now here's a crucial point many people don't realize. Climax and ejaculation are not exactly the same event. Climax refers to the intense neurological sensation of pleasure generated in the brain and nervous system. Ejaculation is the physical act of expelling semen. For most of a man's life, these two events occur together so seamlessly that they feel like a single process. But biologically, they are controlled by separate mechanisms. And that distinction helps explain what we're discussing today. When a man experiences the sensation of orgasm, but little or no fluid is released, doctors refer to this as dry ejaculation. In clinical conversations, many men describe it as an empty orgasm. The pleasure is still present, but the physical evidence they expect afterward is missing. Because this experience differs from what men have known their entire lives, it often creates anxiety. Men may begin wondering whether they are losing their virility, or whether something serious is happening inside their bodies. But the important thing to remember is this: the neurological pathway responsible for pleasure can remain fully intact. What has changed is usually a mechanical or hormonal part of the system responsible for fluid movement. Understanding the reason behind that change is the key to restoring confidence. Before we look at the main causes, let me pause briefly. If you find conversations like this helpful, consider liking the video and subscribing so more men can access reliable health information. And feel free to leave a comment sharing where you're watching from. It's always encouraging to see men around the world supporting each other through honest discussions about health. Now let's examine the most common explanations. One of the most frequent reasons for dry ejaculation is a condition known as retrograde ejaculation. To understand this, imagine a small muscular valve located at the opening of the bladder. During ejaculation, this valve normally closes tightly. Its job is simple: prevent semen from traveling backward into the bladder. When the valve functions properly, semen can only move forward and out of the body. But if that valve becomes weakened or relaxed, semen may take the path of least resistance. Instead of exiting through the penis, it flows backward into the bladder. The sensation of climax still occurs, but outward fluid release is minimal or absent. One subtle clue often appears afterward. Urine may appear slightly cloudy after sexual activity. This happens because the semen that traveled backward mixes with urine inside the bladder. In many cases, this situation is not dangerous. However, it can occur after certain prostate or bladder surgeries where delicate nerves are affected. It can also appear as a side effect of medications used to treat conditions such as high blood pressure or prostate enlargement. These medications relax muscles within blood vessels, and sometimes the bladder valve relaxes as well. I remember one patient who came to my clinic deeply worried after undergoing prostate surgery. He believed the absence of fluid meant something had gone terribly wrong. Once he understood that the change was mechanical, similar to a door that no longer closes completely, his anxiety eased dramatically. His ability to experience pleasure had not changed. Only the direction of the fluid had. Another possible explanation involves a blockage within the ducts that carry seminal fluid. The glands responsible for producing semen may still function normally, but if the pathways carrying that fluid become obstructed, very little reaches the urethra. You can think of these ducts as narrow delivery pipes. If a pipe becomes blocked, the product never reaches its destination. Several factors can lead to such blockages. Previous infections affecting the prostate or reproductive tract may leave behind scar tissue. Chronic inflammation can narrow the ducts. Occasionally, tiny calcifications, similar to small stones, form and obstruct the passage. Symptoms can be subtle. Some men report mild pelvic discomfort during climax. Others notice that fluid volume has gradually decreased over many months or years. The encouraging news is that many duct obstructions can be treated. Anti-inflammatory medications may resolve swelling, and in some cases, minimally invasive procedures can restore normal flow. The third major factor doctors evaluate involves hormones. Testosterone is the primary hormone driving male reproductive function. Most people associate testosterone with libido and muscle mass, but it also plays an important role in regulating the glands that produce seminal fluid. The prostate and seminal vesicles depend on healthy testosterone levels to function properly. When testosterone declines significantly, fluid production may decrease. Men may initially notice smaller volumes of semen. Over time, other symptoms may appear. Reduced sexual desire, less firm erections, lower energy levels, mood changes, loss of muscle mass. This condition is sometimes referred to as hypogonadism, a hormonal deficiency that becomes more common with age. Fortunately, diagnosing it is relatively simple. A blood test can measure hormone levels. If a deficiency is confirmed, carefully monitored treatment may restore hormonal balance and improve symptoms. In most cases, dry ejaculation has manageable causes, but there are situations where medical evaluation should not be delayed. If the change occurs suddenly and is accompanied by symptoms such as pain during ejaculation, blood in urine or semen, fever, loss of genital sensation, it's important to consult a doctor promptly. Certain neurological conditions can interfere with nerve signals controlling ejaculation. Long-standing uncontrolled diabetes may damage nerves as well. In rare cases, certain urological cancers may disrupt the normal reproductive pathway. While these situations are uncommon, recognizing warning signs early allows doctors to intervene quickly. Beyond the physical explanation, we must acknowledge something equally important. For many men, semen is psychologically associated with masculinity, performance, and fertility. When that visible sign disappears, emotions can become complicated. Some men feel inadequate. Others become anxious about intimacy. A few begin avoiding sexual encounters entirely out of fear that something is wrong. These emotional reactions are understandable, but they often stem from misunderstanding. Pleasure, connection, and intimacy do not depend solely on the presence of fluid. The neurological pathways responsible for pleasure remain active in most men experiencing dry ejaculation. Understanding the biological reason behind the change often lifts a tremendous burden. Information restores perspective, and perspective restores confidence.